Hi everyone, let me introduce myself. My name is Fatima Putriagani. You can call me Jasmine. I'm a midwifery student from Poltekkes, Kemenkes, Tasikmalaya, Cirebon. And now, I'd like to show you how to insert intrauterine device. An intrauterine device is a form of birth control that a healthcare provider inserts into your uterus. The procedure to insert an IUD is typically performed by a specially trained doctor or nurse at a GP surgery or sexual health clinic. The procedure usually takes about 5 to 10 minutes, but you should allow at least 30 minutes for the appointment. Once it's inserted, an intrauterine device can prevent pregnancy for up to 10 years or more, and they are safe to use if you are breastfeeding. Most women experience cramping and some vaginal bleeding after the procedure, but this should only last a few days. You should be able to return to work and normal activities the next day. Intrauterine devices are not suitable for everyone. You can get a copper intrauterine device if you have a copper allergy or Wilson disease. Hormonal intrauterine devices are considered safe unless you have liver disease, breast cancer, or are at a high risk for breast cancer. Before we go to the steps, I'll show you what the equipment needed. They are the glove, including a pair of sterile gloves, speculum, an antiseptic solution with applicators, sterile uterine zone, sterile tenaculum, an IUD in sterile packaging, anesthesia with appropriate materials if planning to perform a periapical block, sterile sharp long-handled scissors. Okay, now let's go to the steps. What you have to do first is confirm a negative pregnancy test and obtain informed consent. After that, have the patient move into dorsal vitrectomy position. Don't forget to, with gloved hands, perform a bimanual exam to determine whether the uterus is introverted or extroverted. Next, insert speculum and identify the cervix. After that, clean cervix and vaginal fornix with cleansing solution, typically povidone iodine. If the patient has iodine or sulfate allergy, use chlorine gluconate. At this time, if desired, consider periapical block placement or application of the anesthetic gel as discussed above. Don't forget to switch to sterile glove, and this time, and using sterile single tooth tenaculum, grasp the anterior lip of the cervix and apply gentle traction to straighten the cervical canal and uterine cavity. If the uterus is retroverted, it may be beneficial to grasp the posterior end of the cervix. Using sterile uterine zone, determine the depth of the uterine cavity, typically between 6 cm to 9 cm. If less than 6 cm, IUD should not be placed. If there is difficulty in placing the uterine zone, try cervical dilators. If cervical dilators are needed, it is recommended to use a reciprocal block. Next, all uterine depth is determined. Follow package instruction for the specific IUD when insert. And also, once insert intrauterine device is inserted and string are visible, cut string to a length of 3 cm to 4 cm with sharp scissor, not this length in the chart. Before going to the next step, remove the tenaculum and make sure there is no bleeding for the side of the tenaculum and remove the speculum. Last, have the patient follow up in 4 to 6 weeks for a string check to ensure proper placement. Don't forget to make the documentation. And now, the intrauterine device is installed. Thank you for watching. Bye!